Hello and welcome. Thank you so much for taking time out of your busy day to join us for a webinar that's being presented on behalf of the Michigan Department of Health and Human Services, a project that's funded by the Federal Emergency Management Agency. This presentation is really talking to direct care workers and really hoping that you'll take some time to consider the information and the resources that we have available here to really help best support you during this challenging time. My name is Erin Wallace, and I'll be with you for the duration of this presentation. I have worked with direct care workers and supporting them through education, hands-on training, and developing new training materials, as well as many years ago, I was also a direct care worker. So I understand the challenges and the stresses that are affiliated with this role. As mentioned, this initiative is funded through a grant from FEMA to provide counseling support services to Michiganders during the COVID-19 crisis and is managed by the Michigan Department of Health and Human Services. Today, we're going to go through some basic COVID-19 information. We'll give you some information about the Stay Well program, ways that we can best help to support you, the direct care staff, and followed by questions, discussions that you can share with us via email. So people with COVID-19 really have a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. For older adults, their symptoms can be different than those of younger populations. COVID-19 is typically signaled by 3 symptoms of fever, incessant cough, and shortness of breath. But with older adults, they may not experience the common symptoms. Instead, seniors may seem off, not acting like themselves early on after being infected by the virus. They may sleep more than usual or stop eating. They may seem unusually apathetic or confused, losing orientation to their surroundings. They may become dizzy and fall. Sometimes seniors simply just stop speaking or they'll collapse. The reason has to do with how older bodies respond to illness and infection. There are many ways that you can protect yourself and others from spreading the coronavirus. These that are listed here on the screen are of the most common. So Dr. Peinels is a psychiatrist with the Michigan Department of Health and Human Services. She's the medical director for behavioral health and shares this quote: "Emerging or lingering anxiety, distress, irritability, and loss of hope are important feelings to recognize in ourselves and others, and it can help to talk to someone. If it's helpful, the counselors can also provide callers with referrals to local mental health agencies, substance use disorder support." If you felt any of these feelings described here, please just don't deny that from yourself. Say yes inside your head. The Stay Well Project is here to help everyone that's currently being affected by the pandemic. The COVID-19 pandemic has created a state of disaster in our communities, leaving lives changed and futures uncertain. Even if you've not suffered directly from the coronavirus, no one who experienced a disaster is untouched by it. For many, a disaster continues as a very real presence even long after it's passed. Feelings of sadness, frustration, depression, anger, and anxiety are common, and it's not unusual for these feelings to last for many months. Learning to recognize the normal reactions and emotions that occur can help you better understand these feelings and become more comfortable and effective in coping with them. As someone who's worked throughout this pandemic, caring for those recovering from the coronavirus, taking on new support roles to the residents that you're caring for, you're probably experienced many of these reactions and feelings. However, some may be different or intensified. It's important to recognize that these feelings are real and to ask for support when you need it. Health isn't defined as just physical well-being. Health and wellness is multidimensional, and it includes physical, emotional, career, intellectual, environmental, and social. Each one of these dimensions are a part of your quality of life, and if one area is neglected for a period of time, you may see a negative impact to your overall health. Today, we'll focus on a few of these. While the concept of wellness often revolves around physical and mental well-being, wellness experts understand that there's much more to it than just that. Healthcare staff are trained to be flexible and to deal with needs as they arise, whatever they may be. But COVID-19 is a totally different ballgame. During this pandemic, healthcare workers have faced and are facing traumatic experiences in both their professional and their personal worlds. They face challenges at work treating patients with COVID-19 or dealing with the roll-on effects of the pandemic. Meanwhile, they must contend with coronavirus-related challenges in their own lives, whether children are home from school, partners are out of work, or other pressures that have arisen. Healthcare workers are trained to keep their professional lives and their personal lives separate. Leave it at the door, as we say. But when the boundaries between these two spheres are now completely blurred, they're sharing the same collective trauma as the communities they serve, and that has to be acknowledged. Let's talk about burnout. So, in many different fields, employees can suffer from burnout. This is nothing new. Burnout is a state of complete and utter exhaustion due to the work that has been undertaken. You've probably experienced this kind of thing before as you've worked your backside off to the point where you can no longer function appropriately. It's very common in nursing home staff and direct care workers, as the labor can be taxing on someone's both mental health as well as their physicality. Stress. So, what isn't stressful about multiple call lights going off all at the same time? Knowing that someone needs you, but you can't get there right at that moment. Hearing when you walk in that you'll be running short on your shift, or that there's been several behavioral episodes by residents, and that the prior shift may not have been able to finish all of their tasks due to time and budget constraints. This ever revolving door of changing rules and regulations based on new information related to COVID-19 protocol. You may feel a lack of support. Sometimes it can feel like you're the only person that's working, like you're left on your own and you're so far underwater that you can't see a way out. When someone is left isolated during tough times, it only adds to the issues that they may already be facing. Direct care workers typically have a high volume of workload, high acuity of residents or patients, with little time to perform the tasks that are needed, and with little support from peers, as everyone is doing the same role. There may be a lack of job fulfillment. So nursing homes can be inspiring places to work. Seeing someone up and walking for the first time in months, witnessing a great breakthrough moment of a person with advanced dementia, stringing a sentence together, or coming up with all the words to a popular song. Doing things for others and boosting their quality of life is a very fulfilling thing to do. Sometimes, however, that kind of thing just runs out. Sometimes you watch people decline, and that's hard. It's completely natural and normal to become used to something. A person becomes kind of desensitized by anything if they're exposed to it too much. If they feel as though their job and their lives are going nowhere, then it can be a big strain on a working day. Sometimes you may feel as though you're not able to do enough for people, and that can lead to burnout as well. As direct care workers, you are now not just performing the multiple roles you were prior to the pandemic, but now you're the residents' emotional support, familial support, social support, and nutrition support at times. And this is just at work, not to mention everything that you're experiencing outside of work. This can all lead to feelings of letting others down, your family who count on you, your work family, and residents who count on you as well. And that is simply just a lot of pressure. There may be emotional exhaustion that can happen. And this is really burnout that's composed of emotional exhaustion, a person's loss of emotional resources and emotional coping and energy. We're here to help you through this by helping you to pause and to care for your mental health. Many people struggle with mental health. However, this pandemic is amplifying these symptoms, especially on those that have been working in taxing environments for an extended period of time. It's important that you recognize and acknowledge these feelings and to talk to someone. as a stay well counselor is waiting to speak with you, waiting to listen, and waiting to help you. So these are some signs and symptoms that you may see with burnout. So fatigue, anger, frustration, negative reactions towards others, cynicism, negativity, and withdrawal. You may experience these in symptoms such as physical, psychological, cognitive, relational, and also disturbances. There may be triggers that bring this out more frequently than others. So some personal characteristics, whether that's family or work-related attributes, and work organizational characteristics. The work you provide as a direct care worker is hard. You build relationships with these individuals as they're entering their final phase of life. You provide care and support for them around the clock. You become their second family. This work can be very rewarding, but it can also be emotionally draining. As you've worked through this pandemic, you may have noticed that you or someone you know has experienced the feelings of hopelessness or a belief that change is impossible. Social withdrawal from coworkers, families, friends, or even society at large, or maybe a sudden episode of unwarranted or disproportionate anger. These are signs of secondary traumatic stress, which can lead to compassion fatigue. The term compassion fatigue was coined to describe the phenomenon of stress resulting from exposure to a traumatized individual rather than exposure to the trauma itself. I would consider this pandemic to be traumatic. Compassion fatigue is often an extreme state of tension and preoccupation with the emotional pain and or physical distress of those being helped can create a secondary traumatic stress, or STS, for the caregiver. And when converged with cumulative burnout, a state of physical and mental exhaustion caused by a depleted ability to cope with one's everyday environment, compassion fatigue results. Burnout plus secondary trauma really does equal compassion fatigue. Here are some signs, symptoms, and triggers. So sadness and grief is definitely a sign. Avoidance or dread of working with some patients. Reduced empathy, increased addiction or just addiction in general, nightmares, falling in sick a lot, changes in beliefs, expectations, and assumptions. You may feel this with headaches, digestive issues, muscle tension, fatigue, psychological distress, poor concentration and focus and judgment, as well as relational disturbances. Some things that may trigger this are personal characteristics, previous exposure to trauma, empathy and emotional energy, response to a stressor, the work environment, work-related attitudes, and prolonged exposure to trauma. When you experience or witness burnout and or compassion fatigue, what you see and perhaps experience may be extended periods of time and reduced levels of motivation and interest in the job, which leads to decrease in teamwork, productivity, and fulfillment, which lead to decreased job productivity. This then begins a domino effect of additional stressors and triggers for burnout and compassion fatigue. This can be a result of too much effort in the workplace with limited opportunities for recovery. Your pain, your discomfort, and your worries are valid too. It's important that you continue to process and grow through your own life challenges, as often there's a tendency to ignore your own problems because they don't feel as severe as those that you provide your services to. This hierarchy of pain is a master trickster because the same voice that condemns your own pain as not worthy of attention and support is the same voice that condemns the pain of people who are suffering just a little bit. Those you deem to have more privilege and smaller problems. It judges them for being too sensitive or overreacting to their life challenges. When we activate self-compassion, we can in turn let go of the voice of judgment towards others and really meet them where they are. So how do we thrive in our work rather than just merely surviving? While the tactics employed will vary for each individual, here are 8 rules, that have helped navigate the challenges that can cause burnout. So setting boundaries. Number 1, it's important to work reasonable hours and to commit to disengaging from work based on the commitment you make with yourself. This will be different for everyone, but this rule is crucial. Acknowledge your limitations. You have to embrace the fact that you can't help everyone all at the same time. As one direct care worker has stated, I can't keep burning myself alive to keep others warm. You must accept that there's only so much you can do and that is enough. This acceptance will allow you to be present in both work and play. You need to create space for yourself. So take time to relax and recharge. Unplug as often as possible. Learn to ask, what do I need right now? At one time, it may be solitude. At another time, it might be social support. Be active. So we hear it all the time, but it's important to exercise regularly, fuel our bodies with good nutrition, and allocate adequate time for sleep. These are foundational factors for thriving regardless of your profession. Number 5, find non-work outlets. So another critical aspect of sustaining and thriving is creating a life outside of work. This means engagement with hobbies, friends, loved ones, creative endeavors, and your interpretation of spirituality. Utilize your network. Turn to your coworkers to help you through your shift. Connect with those that are like-minded as you and will offer you support, not add to the stress you are already feeling. You ride the waves of your ups and downs together. Implement a mindfulness practice. And that can be done in many different ways. There are several apps that you can use, or even YouTube for free resources for this. Lastly, call the Stay Well line. To the extent you increase self-understanding and development, you'll build resilience and relieve stress. There's a growing body of evidence that suggests that even brief mindfulness and self-compassion based on skills training can significantly reduce burnout rates. Caregiving during a pandemic, watching the decline of a loved one is tough. For those Americans that are full-time caregivers right now, their level of stress and responsibility is very high. Without the proper support systems in place to allow for respite and the caregiver for time to care for themselves, they're even at a higher risk of medical complications than what they were previously pre-pandemic. For those older adults that are working and raising grandchildren, the worry about meeting all of their care needs while keeping themselves safe and able to care for themselves is harrowing. The grief that you've witnessed firsthand by those who have loved one in a residential care facility, the trauma this presents can really be exhausting. Not being able to be with the person as they pass on can elicit years of prolonged grief without closure. Stay Well Michigan is here to help you through all of the different needs and emotions you have during this challenging time. All of us have been are being impacted because of COVID-19. This virus does not discriminate. However, there are some groups that are and will experience more hardships than others. It's imperative that all Michiganders know that they're not alone. There are resources to help and to assist in normalizing these feelings because they're all shared and at some point in time by all Michiganders. We know that this virus isn't going anywhere anytime soon, and in the duration while we wait, it's imperative to have resources to help individuals cope. This applies to you as direct care workers, but also think about the residents and the clients that you're working with. They're able to call the Stay Well line too. We know that everyone is needing support right now. Please feel free to pass on this information to them as well. This is an unprecedented crisis and it presents unprecedented risks to the rights and safety for everyone. But together, we'll get through this. Thank you so much for your time and attention as I presented the Stay Well counseling line and hopefully provided some useful tips to maintain yours and your family's emotional wellness. If you have questions, please do not hesitate to send me an email or to call the Stay Well line, and they can pass the message along to us as well. We're here to help. The service is available 24 hours a day, 7 days a week, 365 days a year. There's always someone waiting to speak with you. Thank you so much, and stay well.